I'm an FMP student at NKU, just here to do a comprehensive exam. Can you tell me your name and date of birth?
Stephanie Schmidt, 3/30/1981.
Thank you. And what year is it?
2019.
Okay, and who's the president?
Donald Trump.
Where are we right now?
We are in the sim lab at NKU.
Good, and what are we here for?
To practice our assessment.
Good. Silly question.
Yeah.
So aware that speech is clear and appropriate, LOC is awake and alert, and cognitive function is oriented and smart. So upon walking in, I'm kind of doing a general assessment, looking at that skin color is appropriate for age and ethnicity. We did height and weight and calculated BMI prior to this assessment. So let's start with your vitals. We'll get your blood pressure. Good. 122/74. Okay, and I'll just check your pulse here. Pulse is 74 and respirations are 18. Okay, so we will start with the head and assessment. So first we're going to just inspect. So we're looking for any abnormalities, any masses, redness, edema, anything out of the ordinary. We're going to palpate. So just looking on the scalp for any lesions, masses, tenderness. I am also going to check for temporal artery thickening. And then I'm going to have you open your mouth and close it. Any tenderness with your jaw?
No.
Any clicking?
No.
Okay, if you can clench down. Good. Again. Okay. So that is cranial nerve 5, along with, I'm going to do a sharp dull test on your face. So I'm going to have you close your eyes and tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, good. So cranial nerve 5 is intact, and that's trigeminal. And then we will do, I'm on the camera, we'll do ears. So again, starting with inspecting, we're just going to make sure there's no redness, drainage, look behind the ear, anything that is just out of the ordinary. We're going to look in your ears. Okay, so. Okay, so external canal looks great, normal amount of wax, and then also the tympanic membrane is gray, which is good. And we'll do the other side. Okay, so again, inspect, just make looking for any drainage, redness, deformities behind the ear, and again, we'll just look inside. Okay, so external canal looks good, and then tympanic membranes are gray. All right, so we're going to do cranial nerve 8, which is acoustic. So I'm going to activate this tuning fork and place it behind your ear. I want you to tell me if you can hear it, and then when it stops, okay. And then same for next to your ear. Okay?
Yes, I hear.
When it stops.
Okay, it stops. I hear it.
Okay.
Okay.
Okay. And then I should still be able to hear it, which I can. Same to the other side. still hear it. Okay, so one more with the tuning fork. I'm going to activate this and place it on top of your head. I want you to tell me which ear you can hear it in. Okay? Okay, good. So that is, you should hear it in both, and that is the cranial nerve 8, which is acoustic. And then lastly, I'm going to do the whisper test, which is
Apple.
and
Red.
good. Okay, so everything is intact with the ears. We're going to move on to the eyes. So again, starting with inspection, just going to make sure there's no redness, sclera are white, no drainage, make sure the conjunctiva are pink. Good. Going to switch this over real quick. So I have a chart here on the wall. If you could cover your right eye and read me the lowest line that you can see.
L, T, F, P, H.
Good. And then switch eyes.
L, T, F, P, H.
Great. So that's 20/20 on both sides with the Snellen chart. Going to look at your retina and your optic tips. Okay, so retina are orangish red, then the optic disc is bright, and we'll do that same thing for the other side. Okay, everything looks good there. We'll check your pupillary response here. Okay, so I am just going to hold this here, and if you can look, thank you, you can look straight ahead. Okay, so pupils are brown reactive to light and consensual. So we're also going to do 8 visual fields. So I'm going to have you cover one eye, and I want you to tell me if you can guess in the finger. Okay, switch. Yes. Yes. Good. Okay. Let's see. So we did cranial nerve 2, which is optic, and then we're also going to do cranial nerves 3, 4, and 6. So we checked your pupillary response with the pen light. We're going to do extraocular vision, which is the H test. So if you could just follow my finger and keep your head straight. Good. Okay, so those are intact. We'll move on to nose. So starting with inspection, we're just making sure that the nose is in line. It's not deviating to one side or the other. No redness, drainage, abnormalities, masses, all that good stuff. Going to do sinus palpation. So we'll do frontal and maxillary, anything sore, tender, okay? And then I'm going to use the light here, and we're going to look in your nose. And I'm just looking for polyps, drainage, the vessels, because that's a common spot for nosebleeds, and then septum perforation. Okay, good. Okay. So we'll do the smell test, which is cranial nerve 1 olfactory. So if you could close your eyes, call one nose, and then tell me what you smell.
Alcohol.
Strong. And then we'll switch. Okay, so cranial nerve 1 is intact. And then we're going to move on to throat. So I'm going to have you lean your head back and open your mouth, just looking at the soft and hard palate. So the soft should be pink, the hard palate should be white. I'm going to take the tongue depressor. If you can say out for me. Good. Okay. So that we're just looking for that the uvula is midline as it rises, and then gag reflex. So that is cranial nerves 9 and 10. And then we're going to move on to neck. So starting with inspection, going to make sure that your neck, the trachea is midline, there's no deviation, no masses, redness, deformities, things like that. I'm going to have you swallow. Good. And then I'm going to have you kind of go to the side here, and I'm going to go behind you and palpate your thyroid. So just feeling, there we go. And if you could swallow, good. Any tenderness or anything?
No.
Okay, and just checking to make sure that it's mobile, appropriate size, all of that. Let's do your lymph nodes. So we're going to start here. Okay, so lymph nodes, we're just looking to make sure that they are appropriate size, that we don't have any tenderness, that they are mobile, the consistency, and if they are clumped together or apart, which is the delimitation. So then we're going to move on to heart. Okay, so I'm going to start by auscultating your carotid arteries. I'm going to have you take a deep breath and hold it for me. Good, and a breathe. And then I'm going to auscultate the heart sounds. So just looking to see if there's any rubs, gallops, or heart murmurs, which I don't hear anything. It all sounds good. So we'll move on to, I'm going to have you lay down, and I'm going to look for jugular vein distension. So once you're laying, if you could look to the side, and then I'm just looking at our neck here to see if there's any pulsating and distension of that vein. And I do not see anything. So we will move on to abdominal. Okay, so I'm going to start with listening to vowel sounds. Okay. And inspection, making sure that there's no distension, herniation, abnormalities, shifting or anything like that. I'm going to palpate. So first light, and then we're going to do a deep palpation. Okay. So in palpation, you are looking for hepatomegaly, splenomegaly, or herniation, and I don't feel any of that. We're going to move on to peripheral vascular. So peripheral vascular, I am just looking for any varicose veins, any readiness from peripheral vascular disease. We're going to check for edema, and then we're going to check cap refill. Good. Okay. So peripheral vascular, everything looks good there. We're going to do the lung assessment now. So I'm going to start with just assessing to make sure we don't have any barrel chest, that the AP diameter is appropriate, which it is. Now we're going to auscultate. Some deep breaths. Now I'm gonna do a finger down here. Again, do a deep breath. Okay, so lungs are clear. So now we'll start on the back. I'm gonna, every time I touch you, I want you to say 99. And this is just testing for tactile firmness.
99, 99, 99, 99.
Good. Okay, so same thing.
99, 99, 99, 99.
Okay, good. Musculoskeletal. So we'll start with sensory. So first one I'm going to do is the sharp dull test, which I know we did this earlier, but we're going to do it a little differently. If you keep your eyes closed, and then tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull.
Yeah. Okay.
Sharp.
Dull. Okay. And now we're going to do the cotton wrist test. So tell me what side you feel this on.
Right. Left. Right. Or left. Sorry. Right.
Okay. And then last one, again, if you could close your eyes, and I'm going to touch your arm, and if you could tell me which one.
Right.
Left. Left. Okay. Okay. So sensory is intact, and then we're going to move on to motor. So we're going to do the finger thumb test. So if you could do this, very good. Good. And then I'm going to have you touch your nose and touch my finger, keeping your head straight, and I'm going to move my finger around. Good, and switch hands. Good. So that's looking at coordination and motor abilities, and all of that is intact. Now have you stand up, and we're going to walk heel to toe from here to just right before the wall, and then turn around and come back. All right, you can take a seat, and we're just going to test your muscle strength. So arms up like this, push against me, pull. You can put your wrists out, lift up, down, spread your fingers apart, don't let me close them, good. Keep your leg out, good, pull, out, pull, good, very good. Okay. That just okay, let's move on to reflexes. Okay, so first one we're going to do is kind of relax your arm. Good. Okay, if you could flex. Good. Good. And have you kind of hang your arm here. I'm going to test right here. Good. All right. Tiller. Good. And then Achilles. Good. Okay. All right. So reflexes are all intact. The other cranial nerves that we missed, we're going to do 7, which is facial. So if you could raise your eyebrows, puff your cheeks out, smile. Good. And then we're going to do 11, which is spinal accessory. So if you could push against my hand, from here, side, side, shrug your shoulders. Good. All right. So that's intact. And then 12, which is hypoglossal. If you could stick your tongue out. Good. And say no ifs, ands, or buts.
No ifs, ands, or buts.
Good. So that's also intact. And then cognitive function is the final. I'm just going to give you 3 words to remember, and we'll recall them later. So they are red ball house.
Red ball.
Good. Can you count to 50 by 5s?
5, 10, 15, 20, 25, 30, 35, 40, 45, 50.
Good. And then can you recall those 3 words for me?
Red ball house.
Very good. Everything looks good. Let me just run through and make sure I've got it all. is good. Do you have any questions?
No.
Okay, thanks for coming in.
Thank you.